When do side effects from lymphoma chemotherapy usually start? Have you ever wondered when side effects from lymphoma chemotherapy typically begin? Well, the timing can vary, but generally, side effects start shortly after treatment begins. Most patients notice effects within hours to a few days after their first treatment. The specific drugs used, the dosage, and how each individual responds all play a role in this timing. Chemotherapy works by targeting rapidly dividing cells. This includes cancer cells, but it also affects some normal cells in the body, like those in the bone marrow, digestive tract, and hair follicles. As a result, common side effects include nausea, fatigue, lowered blood counts, and hair loss. Many patients report experiencing nausea, vomiting, and fatigue within the first 1 to 3 days after receiving chemotherapy. These initial side effects can be quite uncomfortable. Additionally, low blood cell counts, which can increase the risk of infections, often develop about 7 to 14 days after treatment as the bone marrow is affected. Some side effects appear quickly, while others may develop more gradually or persist throughout the treatment cycles. For instance, nausea and vomiting often start within hours to a day after chemotherapy and can last a few days. Fatigue can kick in soon after treatment and may build up over multiple cycles, making patients feel increasingly tired. Low white blood cell counts, known as neutropenia, usually develop about 1 to 2 weeks after chemotherapy. This condition can raise the risk of infections during this time. Hair loss typically begins 1 to 3 weeks after starting chemotherapy. Mouth sores and digestive symptoms may also appear within days to weeks, depending on the specific treatment regimen. It is important to note that chemotherapy regimens for lymphoma can vary widely. This means that the exact timing and severity of side effects can differ from one patient to another. Oncologists closely monitor patients and may prescribe supportive treatments, such as anti-nausea medications or growth factors, to help boost blood counts. Patients should always communicate any side effects to their healthcare team promptly. This ensures that any issues can be managed effectively. While side effects usually improve after chemotherapy ends, some may persist or even appear later. In summary, side effects from lymphoma chemotherapy generally start within hours to a few days after treatment begins. Some effects, like low blood counts, may develop over the following 1 to 2 weeks. The pattern and timing of these side effects depend on the specific drugs used and individual patient factors. Close medical supervision is essential for managing side effects effectively and ensuring the safety of the treatment.